So welcome everybody to this public hearing organized by Zero COVID Campaign Scotland, the Real COVID-led People Speak. My name is Carmen Simon. I'm a member of the Edinburgh TGC, and it's my pleasure to be chairing this meeting today. We have an amazing panel of speakers who are going to talk to us about how COVID had impact on all of us, and probably more some than others. The event will have two parts. The first part is the panel of speakers, and they will have time for some general discussion. I would appreciate if everybody mute themselves while they are not speaking, so we can avoid noises in the background. Everybody can use the chat box option that is at the bottom of the screen to make comments or to ask questions. Our colleague Mandy is going to be checking this chat option, so we can gather all the questions for the second part of the event. There is also an option at the bottom of the screen in the section that says more, that if you click in there, you can access to live caption in the section that says live transcript. So you can have a live caption of everything that is being said by the speakers and participants. So I'm really excited to hear about from our panel. So I'm not gonna add anything else. So I'm going to introduce to our first speaker, who is Professor Andrew Watterson from the University of Stirling.
Hello there. I'm very pleased to be contributing to this session. We're going to hear about the lived experience of those dealing with COVID in Scotland, not what politicians and their advisors sometimes think it is. Politicians' misapprehensions about COVID can shape seriously flawed and damaging policies for many vulnerable groups, including workers, the young, the disabled, those discriminated against in terms of their mental and physical health, and their economic and social struggles. Warm words from politicians must translate into effective action. Often they don't in Scotland, and voices that should be heard are often muted, ignored, or silenced. So before we hear from members of those groups, I'm just going to spend a minute or two looking at where exactly we are in Scotland in dealing with the pandemic and how that impacts on the population at large in health, social and economic terms. So up to August the 27th, 2021, we'd officially recorded more than 400,000 positive COVID tests, almost 30,000 hospital admissions, and more than 8,000 COVID deaths. And in that number, we're probably talking about 80,000 people who are estimated to be living with long COVID. We threw the switch on most but not all COVID controls in July and August without adding mitigation or even achieving all the past COVID control targets that we'd set ourselves. Then the blindingly obvious happened. We got another wave. The week ending April the 23rd saw just 188 officially recorded positive COVID cases across the country. By the week ending the 30th of August, there were 6,201 cases. That's something like a 33-fold increase in cases. In just 1 weekend, in the 30th of August, we had over 40,000 COVID cases. At a quite conservative estimate, that could well mean 4,000 more new cases of long COVID, as well as all of the other health ill effects. There have been indications this week that the Scottish Government is moving to drop the COVID suppression strategy that it had early on completely. Ministers seem to believe there's been a successful vaccination rollout with a related drop in serious ill health from COVID. So the shift in policy, it's been argued, will now prevent significant social, economic and educational harms from suppression. Well, as they say, here's the thing. We've seen COVID hospital admissions and acute care numbers rise as positive COVID cases also rocketed right across the country. What sort of a policy is that? If vaccination is the key way forward, as our Deputy First Minister thinks, why has the switch been thrown prematurely on COVID controls? For example, on the 2nd of September, 17 out of every 100 over 18-year-olds were still not double vaccinated. Around 1 in 2 18 to 29-year-olds weren't double vaccinated. Only just over 8 out of every 100 16 to 17-year-olds were vaccinated, and 12 to 15-year-olds weren't vaccinated at all. If ventilation is a key part of the Scottish Government strategy now, why are we told that all schools will, by October, and this is a Scottish Government phrase, if possible, have checked their ventilation levels with carbon dioxide monitors? Why has this not happened by the end of the last school term or by the end of August this term? And carbon dioxide monitors are only part of the ventilation picture. Why is there no mask policy operating in primary schools now? No vaccination policy applying in secondary schools? And why are people very confused about what exactly we mean now about well-ventilated indoors and workplaces? And what does physical distancing now mean? Exhortations by ministers and their advisors in the last few weeks to be careful, their phrase, and to try and check if those around you have been double vaccinated doesn't translate into workable or effective COVID public health policy. We should consider too, on the basis of the stats that we've got, we already have on COVID, the damage done by not suppressing the virus. This is because COVID cases not only harm health, but they harm the social, educational and economic position of individuals and threaten the education, healthcare, hospitality sectors as well. A zero COVID strategy, in contrast, using relatively simple but well-tried, tested and successful steps to stop transmission, and we'll hear more about this later, I think, is designed both to suppress COVID by reducing COVID cases to the lowest number possible and avoid disruption to schools and businesses. It should also avoid any future large-scale lockdowns as well. That's a win-win approach in contrast to the government's lose-lose result. The evidence we now have about the de facto end of the suppression strategy by the Scottish Government is clear, and it's failed badly. In Alice in Wonderland terms, they've done the opposite of what they intended. Thank you.
Thank you very much, Professor Watterson. Actually, when you look at the figures like that, it really is an eye-opener. Thank you very much. Our next speaker is Jane Ormerod from Long COVID Scotland.
Hello, I'm Jane Ormerod. I'm 64 and retired after working in the NHS for 40 years as a nurse and nurse educator. Prior to COVID, I was fit and agile. I walked, cycled, did Pilates and yoga. I first became ill in March 2020 with symptoms of headache, sore throat, muscle pain, chest pain, tachycardia and breathlessness. After contacting 111, I was sent to the local COVID hub. I was not admitted to hospital and was told to return home and rest. I was not tested for COVID-19. Testing was fairly new at that time. Struggling with chills, breathlessness, tachycardia and insomnia, I felt scared and wondered if I would die. I got better getting through the first 3 weeks. Little did I know what was ahead of me. I had a few weeks where I definitely felt better. Soon though, my sore throat came back and got worse. My other symptoms came back. From May to August, feeling really unwell, I tried to contact my GP several times with few successes. I was given 2 courses of antibiotics. Several GPs were supportive. Others doubted I had COVID. At one point, I was passed from GP service to 111 only to be sent back to the GP practice. During this time, I was not seen face to face, only spoken to on the phone. One helpful GP trainee finally saw me and took throat swabs and blood samples. I paid privately to have blood tests done to find any vitamin deficiencies so that I could take the right supplements. At this time, a longer-standing health problem also became worse, and I tried to get the GP to contact the consultant to see if I could be treated. One GP refused, and a nurse practitioner finally contacted the hospital. In October, I attended the hospital clinic to get a minor procedure done under sedation. Afterwards, I was very unwell and had to stay in the hospital for 2 hours until I felt better. For 2 weeks after this, I could barely function. I joined the supportive long COVID support group and Long COVID Scotland Action Group on Facebook. Also helpful was online yoga for long haulers and breathing exercises to ease my breathlessness, as well as counselling to get my head around what was happening to me. By December, I was still unwell. Unfortunately, just before Christmas, my husband became seriously unwell with a heart condition and spent 5 weeks in hospital. Then I knew that stress also made my symptoms much worse. By April 2021, my husband was a bit better. However, he now has a life-changing heart condition. I was still struggling with extreme fatigue, breathlessness, joint pains, migraine and tinnitus. I saw a rheumatologist privately as referral through the NHS seemed impossible. I'm fortunate I could do that, and I realised that not everyone can. By August, my life has changed. I can't do the things I used to. My activity level, physical and mental, has to be balanced with how I feel, and I rest frequently. I still speak to a counsellor to help me cope with what seems to have become a chronic illness. In the Long COVID Scotland Action Group, I co-chair the research subgroup, being involved as a patient representative in a number of long COVID research projects to hopefully benefit others with long COVID now and in the future. As we speak, we find ourselves in Scotland with few organised treatment and rehabilitation services for increasing numbers of long COVID patients. This is clearly unacceptable and has to change, and I hope to be part of that change despite still being unwell.
Thank you. I guess that Jane is not here now, but I mean, I think it was a really powerful speech about the impact of long COVID, and it's something that we are seeing more and more when we are representing members in unions. So thank you very much, Jane, for the recording. I think the next speaker now it would be Anita Shanley for surviving lockdown.
Well, I don't have a tale of woe. I am one of those who were shielding because I have myeloma and I have COPD. But at the same time, I wanted to emerge out of this COVID to be able to continue. I live in a street which is quite professional. There are 2 dentists and I have 2-3 friends in the street. But they happen to be having works on this street. So it was quite closed for traffic. It's usually very, very busy. So I would go out and make a point of, although I was shielding, that I needed to keep my lungs working and to keep my legs moving. So we have a surgery across from us and the breast clinic. So I always took a walk there, and invariably I would meet the pharmacist hurrying down with all the prescriptions from the surgery and saying, "Mrs. Shanley, what are you doing here? You should be at home. You should be shielding. You shouldn't be out here." I said, well, if I'm going, then I have a choice. Either at the end of this, I can walk and breathe, or at the end of it, I'll just be a vegetable sitting on a sofa. So, we did take care, my husband and I, who is 94. We did clean our hands. We did get very very few times on a bus. And we did do our own shopping because I'm very keen on being from the Middle East, on having my vegetables and fruits. So we both put our masks on and washed our hands, washed our keys, washed my stick. And it was also important for me to keep mentally active because I was in the middle of writing my book, which is called Ancestral Journeys. And I encountered Western missions, and I was worried whether it would eventually see the light of day and whether the printers Crawford Print would manage to stay, because at that moment they were all on furlough. But so I had done quite a bit. It was really memoirs of the family accumulated over the years, and I had made quite good headway in it. So luckily, they functioned, the Crawford Print, they still function, and we managed to get the graphic designer put in all the pictures I wanted of the family, and we were safe. Really, my experience with COVID was really in Lebanon, where I come from, where my very dear friend died because of the helpers who came. And my sister's also very dear, strong friend also died because of people coming in, workers or carers or whatever. Of course, I think during this time, the most difficult thing was the reports we got about the care homes. And we were very grateful, my husband and I, that we are able to live in our home and to carry on, as we did, and to come out of it really with a book published, with me able to walk and breathe, and still here.
I think it's for the future. I think it's important to bear in mind these really difficult experiences from people that have to be shielding or have been living alone, and to learn from the experience and how can we mitigate the impact of lockdown in people that couldn't really leave their houses. So thank you very much, Anita. The next speaker is Keith Paterson from COVID Issues from LGBT People. Keith, please.
Good morning, everybody. I work for a charity, LGBT Health and Wellbeing, but today I'm speaking in a personal capacity. I'm also not speaking for the whole LGBT community, which is very diverse, but just to give you a few observations and thoughts in particular about how COVID is affecting LGBT people in perhaps slightly different ways. Obviously, everyone is affected by COVID, but individuals from marginalized and disadvantaged groups experience poor health outcomes. LGBT people aren't more likely to contract COVID-19, but we need to consider the following factors. LGBT communities are disproportionately impacted by HIV, more likely to smoke, more reluctant to access healthcare because of previous homophobic and transphobic issues. LGBT folk are less likely to be active and are actually more likely to be homeless. So all of those factors are at play. One thing I'm finding in the work that I'm doing, which is with older LGBT people, is an increasing social isolation. LGBT people are more likely to be socially isolated. They're more likely to be living on their own. They're less likely to have family support and less likely to have a support network. Sorry?
Sorry, I think there's been someone unmute herself. So yes, go on, please, Keith.
Okay, I thought it was a question. So LGBT people are more likely to have poor mental health. Unfortunately, there are higher rates of smoking, alcohol, and drug abuse, and many of these issues are worsened by disruption to routine, and they can't have been a bigger disruption to routine than COVID and the ensuing lockdown and problems from that. We're finding that our services are really at breaking point in terms of people isolated, and although restrictions have eased, there are many people with huge health anxiety who just aren't prepared to face the world again. I know from other organizations that they can't take any more people on. Counseling services, befriending services, telefriending services are absolutely stretched to the limit. And now funding is becoming an issue as well, because everybody's chasing funds to try and keep these services going, or to try and increase the capacity of the services. But unfortunately, there is a huge demand for any funding that's available. So as I said at the beginning, I don't pretend to speak for the whole LGBT community, but there are definitely instances where LGBT people are affected, certainly in different ways than the general population, and that's what I wanted to say today. So thank you for the chance to tell you a little about the effect that COVID and the restrictions and the general anxiety is having on the LGBT community. Thank you.
Thank you very much, Keith. Also, thank you for being in on time. I think it's important. I think there's been groups in this. It's been clear in the pandemic that some groups have been more vulnerable to the impact of COVID, and it was really an eye opener to listen to you and to hear why this community, this LGBT group, are more vulnerable. So thank you very much